I fractured my skull when a ping pong table fell on me. So when I was 10 years old, I was pulling out this big, heavy ping pong table, wooden ping pong table, none of this nice, fancy, lightweight aluminum that is how they're built nowadays. But it was a wooden ping pong table, full size. I was pulling it out of the garage, and the garage had like a little slope. I don't know if it was that. I don't know if a rock got caught in these like old metal rusted wheels. Something happened. I was pulling it towards me, and that thing fell on my body, sent me to the pavement. It was concrete driveway, and I hit the back of my head really hard enough to cause a hairline fracture of my skull. Along with that came a concussion. So in that concussed state, I got evaluated. We went to the doctors. They initially told us, go on home, monitor symptoms, because I had been vomiting at this point. I was certainly out of it. I was dazed. I was sleepy. All of the classic concussion type symptoms. I hope nowadays, if that were the case, they would have kept me immediately, but nevertheless, they sent me on my way. In that, few hours between being sent off from the doctor's office, I vomited a lot more. My symptoms were not improving, so my parents took me to the hospital as advised. There, I got a CT scan. They discovered the hairline fracture of my skull. They ruled out any internal bleeding or anything like that, but they wanted to keep me in the hospital for observation, for further tests, to just see how I was progressing. If I remember correctly, which I'll get to in a second, I think I was just there one night and the most of the next day before I was eventually released, and that was it. This was the early 90s, early to mid 90s, and again, that was kind of it. There was no follow-up. There was no let's evaluate you again, let's do future imaging, none of that. I went on home. I was told to take it easy for a little while, but I was dealing with these headaches. I remember the persistent headaches that were there for a good amount of time, and honestly, up until sort of recently, I kind of forgot about the experience, but we were talking as a family about a certain birthday party, and I tend to have a really good memory. I'll remember real fine details. I'll remember a lot of stuff, but in discussing this birthday party, I had no recollection, and it was for one of my cousins, and the location was unique. There were enough things that I should have been able to remember at least some of the aspects, and in this conversation, I came to realize that it may have been the summer that I had a concussion. So having lived through that experience, having gone through it as a kid, now I would look back and I would do things a lot differently because I know a lot more and technology has improved and more resources are available. And the reason I bring all this up is because recently we had a kid in here, a teenager, so a little older than I was, but he had a head injury. Head hit the pavement, similar to me, and here's what his scan looked like. I didn't get one of these scans. All I got was a CT. We didn't know about this. Honestly, I don't even know if it was invented quite yet. I'd have to look back and see when this particular company started manufacturing this. But here's what I can tell you. Now being on this side of it and being able to support someone else, I'm going to tell you the things that we're going to do to help this young boy get better. So first off, you already saw it on the screen. We're going to do an evaluation. We got to see how his nervous system is operating after the trauma. Then we're going to start with our chiropractic care. So he's going to get adjusted very specifically and very gently, I should add. With these cases, there is, and this could apply to any case, but we're going to pay special attention to make sure that we don't over adjust. We have 30 plus joints in our spine. That doesn't mean we need to move every single one. We want to focus on the ones that are subluxated, that are going to have the most impact in the nervous system overall. So we're going to continue that until his next evaluation. At that point, we'll repeat the same trio of scans. We'll see what's improved. We'll see what's still hanging out. We'll figure out how we're going to continue to make positive progress. In addition, we're going to do laser therapy. So the laser we use is great for inflammation. It is great for supporting the body. It is great for healing. So we're going to utilize that tool as well in this case. We are also going to use spinal fulcrums, or what we call spinal molding tools, in order to help with the curvature of the neck and positioning of the head. When the time comes, we might use this one. We might use this one. We'll see which one it ends up being ultimately, depending on what's best for him at that time. But that's going to be a few weeks out. And in this whole process, of course, we're going to be getting feedback from him and from his mom, letting us know what the headache situation is like, the frequency, the intensity. We also want to know what focus is, because focus and concentration has been challenging for him since this trauma. So in my mind, and I hope you agree, so when I think back on the past and I think like, oh man, if I had a time machine, I would go back, I would change what the protocol was, I would make sure that I got better follow-up care. All of that, yeah, for sure. But that's not the world we live in, or is it? As of right now, I can't go back and do that. But what I can do is use the knowledge we have now, take that experience, couple it with modern technology and things that we know how to do through chiropractic care, and help kids who are dealing with this sort of thing, so that brain fog, the headaches, the concentration issues that in the past kind of just got dismissed and you'll get over it when you get over it. Let's do something now about it to help these kids so it doesn't hold him back in high school, hold him back from athletic endeavors, hold him back from whatever he may want to do. So if you know someone whose child recently suffered a head injury, please pass this along to them. Let them know that there are options, that they can be proactive about the recovery and the healing for their child. If you have any questions about my experience as a kid, if you have any questions about protocols that we're going to put into place, any of that stuff, put it down below in the comments. If not, thank you again for watching, and like I said, pass it along to someone who may need help.